Every minute, someone dies from high blood pressure related diseases, and most of them had no warning signs. Physical therapy play a critical role in helping patients lower and manage high blood pressure through safe movement, lifestyle guidance, and long-term behavior. In this video, we unpack the science, share clinical insights, and show you how physical therapy empowers both patients and professionals to fight the silent killer. We'll uncover what high blood pressure is, how physical therapy addresses it, and finish with a full patient-centered management plan that includes movement, breath work, and self-monitoring. Now, starting by understanding what hypertension is. High blood pressure or hypertension occurs when the force of blood against your artery walls stay consistently high. So this puts pressure on the heart, the brain, the kidneys, and the arteries. So if we are just to recap what we have defined hypertension as, so normal blood pressure is 120 out of 80 millimeters of mercury. Then elevated or high blood pressure is 120 to 129 out of less than 80 millimeters of mercury. So that is elevated blood pressure. Then stage 1 hypertension is 130 to 139 millimeters of mercury out of 80 to 89 millimeters of mercury. Then stage 2 hypertension is more than or equals 140 out of more than or equals 90 millimeters of mercury. So this is what we define hypertension as. Occurs when the force of blood against your artery wall stay consistently high. So this put pressure on the heart, the brain, kidneys, and arteries. So some of the risk factors include inactivity, that is living inactive lifestyle, obesity, we have high sodium diets, we have stress, we have smoking, we have age, and genetics. So these are the main risk factors for hypertension or high blood pressure. If left untreated, it increases the risk of stroke, that is cerebrovascular accident, heart failure, kidney failure, and cognitive decline. So, physical therapists are trained not just in movement, but in cardiovascular health, and here is where they fit. Now, the key roles in BP management or blood pressure management include exercise prescription for cardiovascular conditioning. Number 2, we have breathing and relaxation training to reduce the sympathetic tone. Number 3, we have behavior change coaching, that is via motivational interviewing, goal setting. Number 4, we have education promoting patient self-efficiency. Number 5, screening and referral for red flags. So an evidence snapshot, moderate intensity aerobic exercises reduce systolic blood pressure by 5 to 8 millimeters of mercury. Then resistance training also contributes to BP control, especially when combined with the cardiovascular conditioning. The impact we make in BP control can be equal to a first-line medication without any side effects. So that just tells you how important it is to be active. So talking of exercise prescription for hypertensive patients, so let's talk practical. What should PT and patients actually do? Number one, we have aerobic exercises. The types, we have walking, cycling, swimming. Frequency of 5 to 7 days per week. Intensity should be moderate. And then the duration should be 30 to 60 minutes per day. Walking is one of the most effective and accessible tools, and you should start with 10-minute boats and build up. Number two, we have resistance training. So with resistance training, frequency of 2 to 3 days per week, and 1 to 2 sets each, and 10 to 15 repetitions. Just as a precaution, you should avoid Valsalva and encourage breathing throughout. So a sample circuit includes the squats, wall pushes, resistance band rows. Then number three, we have breathing and stress management. So stress elevates blood pressure through the sympathetic override, and we must train parasympathetic activation. So an example is diaphragmatic demo. You should sit upright or lie down. Inhale through the nose for 4 seconds. Hold for 2 seconds. Then exhale slowly through the mouth, and should be repeated for 5 to 10 minutes. It is recommended 1 to 2 times daily. So we just talk of diaphragmatic breathing. So sit upright or lie down, then inhale through the nose for 4 seconds, hold for 2 seconds, exhale slowly for 6 seconds through the mouth, then repeat 5 to 10 minutes. This should be done 1 to twice daily. Then now let's look at the screening the safety screening before exercise. So before prescribing exercise, especially for new or uncontrolled hypertension, always screen your patient, and you can use one physical activity readiness questionnaire. So this is a questionnaire that you can use. Number two, we have BP reading pre and post exercise. So you measure the blood pressure before and after exercise. Then number three, monitor the symptoms such as dizziness, headaches, and chest discomfort. So some of the absolute contraindications while doing this include a resting blood pressure of more than 180 out of 110 millimeters of mercury. Then we have unstable angina. So if they have central chest pain, then that is referred to the central chest pain that is referred to the jaws and the left arm. Then recent cardiac event. So these are the absolute contraindications. We've talked of resting BP of more than 180 out of 110 millimeters of mercury, unstable angina, and recent cardiac event. So they should be referred if referral is required if the BP is uncontrolled with medications. Then there is suspected secondary hypertension and the patient is symptomatic. So you refer if the blood pressure is uncontrolled with the medications, the first line and the second line drugs, then suspected secondary hypertension, then patient is symptomatic. So a case example here, we have a patient by the name Mr. K. So the patient profile, this patient is a 58-year-old male, living sedentary lifestyle, newly diagnosed with hypertension of 138 out of 88 millimeters of mercury. He works in IT department. He's overweight and involved in poor sleep. So he's on no medications yet. Then physician recommends lifestyle change. So intervention plan was a 5-day per week walking program. Start with 15 minutes per day, then breathing exercises every morning, weekly telehealth PT coaching that included goal setting and habit tracking, then dash diet information via a handout. So after all this, in just 6 weeks, his blood pressure dropped to 124 out of 80 millimeters of mercury. He lost 300 kg. He lost 3 kgs, 3 kilograms, slept better and avoided medication. So here is a case example or a case study of a patient who was newly diagnosed with hypertension of 138 out of 88 millimeters of mercury, and after the intervention, his blood pressure dropped to 124 out of 80 millimeters of mercury. So some of the practical tools for patients and clinicians. For patients, you can download, you can have a 7-day blood pressure self-care tracker using a reliable BP monitor. We have dash diet guide and then fitness bands. Then for students, we have guidelines for exercises in hypertension, blood pressure recording log plus a red flag checklist. Then some of the recommended books include the chronic disease exercise prescription. And for professionals, you have sample exercise handouts for clinic use and motivational interviewing template. So high blood pressure is silent, but PT does not have to be. As movement specialists, they have powerful tools to restore control, build confidence, and prevent complications. If it made sense and added value, like, then comment, are you a patient, student, or clinician? And what worked for you? For more evidence-based wellness content, subscribe.